You're listening to an archived Cabral Concept podcast. After listening to this show, check out the most up-to-date podcasts available at stephencabral.com/podcasts or search directly on iTunes. And now, welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
So excited that you could join me today on our first weekend house call, where we will be answering, as always, our community's questions. So every week, or I should say of every day of every week, we get new questions coming in. Those questions come in from stephencabral.com/askcabral. Unfortunately, at this time, I'm not able to answer direct messages on Facebook, on Instagram, on Twitter, and on every other social media platform in the world. We literally get dozens and dozens a day. And I would say overall, we get over 100 questions by email, by social media, in the support group, all those different channels. And we have a nice little system for all of that, but I am not able to answer your questions unless it's submitted to stephencabral.com/askcabral. And then I answer them on these weekend house calls. And typically it's taking now about 4 to 5 weeks for me to get to each individual questions. But do keep in mind, this is only if I need to answer the question for you. If you don't mind my team of amazing health coaches answering your questions, as well as the community, please submit that question for daily answers at Monday through Friday at cabralsupportgroup.com. That's the name of it, cabralsupportgroup.com. It's a free Facebook group. You can get your questions answered right there. You can get support from the group. You can ask for support. You can post your success stories. We love it. All that is right there. We have now over 1,000 members. Amazing. I remember when we started that maybe just a year or so ago. I don't know how long it's been, but I think it's been, I do remember. It's been almost about a year and a half now. I started it, I believe, last October of 2016. So excited to see that group grow. Amazing. We've never once advertised it like ever. I just started talking about it on the podcast maybe 6 months ago. And it's an amazing group. I mean, that's the bottom line. The people in that are fantastic. I love popping in at least once a day, seeing what's going on. And I typically leave a few comments myself. So great place to check that out if you don't want to wait the 4 weeks or so, potentially a little bit longer, for all the questions that come in, since I answer them in order that they come in. All right. So having said that, we have a lot of questions to get through. I'm going to get right into it today. The first one today is from Lois. Lois is asking, "Dear Dr. Cabral, thank you for everything you do. You are truly amazing. I have an issue and I'm looking for some guidance. For the past 8 years, I've been dealing with acne and I can't get rid of it. I was diagnosed with colitis when I was 10, but for the most part, I have it under control. Now, my acne goes away when I'm on vacation, but it always comes back when I'm home. Here's the kicker, though. I'm a functional medicine practitioner. I ran half a dozen tests on myself. I've rebalanced my hormones, got rid of parasites, cleared infections, detoxed heavy metals, and yet my acne persists. I even got implants in my teeth that had root canals because Dr. Mercola said that he had acne until he was 40 and didn't go away until he got his implants. Now, of course, my skin has drastically improved over the years, but it's not clear. I'm wondering what you would do and what you'd suggest. Thank you, Lois." Okay, here's the deal, Lois. You gave it away. You gave it away in your question. This is something, so you're a functional medicine practitioner. I want you to use this in your practice. Remember, I give away everything I do in my practice. And in about, I would say it's like 4 months away, maybe 5 months away, I'll have a certification and just course as well, because I don't want it just for health practitioners, although I will be teaching health practitioners, of course. You need to ask this question in your consultation. Have you ever got rid of X, that symptom? Has there ever been a time in your life? Does it ever go away? Has there ever been anything that you've done where that X goes away, that symptom? Okay, so you have acne, and I would ask you, is there ever a time in your life that it went away? How long have you had it? When does this go back to? Okay, have you gotten rid of it? Had you had success with anything in the past year, 2 years, or 3 years? And you would say, yes. When I'm on vacation, my acne goes away. But when I come back home, it comes back. Okay, I would say, well, we've already found our answer. Now we just need to know. Remember, I just consider what I do basically forensics, right? It's essentially being a detective. It's a true detective. So I already know that you can get rid of it because it goes away on vacation. So, and I'm going to spend a little bit more time on this question because if you understand this question, you understand essentially how I'm digging deep into these questions, why doing a real proper intake. People ask me, can't you just give me recommendations our first time we do a consult? And I say no, because the entire first consult is me making sure I know exactly who you are, the life you live, the type of person you are, your constitution, all of those things, so that I can help you at the deepest level so that this goes away permanently. I'm typically the last person people go to, meaning like, okay, they try to use their health insurance for this or for that. And you know, with naturopathy, we just can't accept health insurance, okay? So the truth is this, that I wouldn't take it in the first place because I'm not going to play the health insurance game. I'm not going to make you follow a course of action because that's what health insurance wants. I'm going to ask you, because you're a participant, of course, in your health, it's your health, to say, this is what I believe that's the best course of action, independent of what anybody else wants me to do. I don't want anyone telling me what to do, meaning that I'm not a functional medicine practitioner, I'm not an orthomolecular, I'm not a naturopath, I'm not an Ayurvedic, I'm not a traditional Chinese medicine, I'm not an acupuncture, I'm not any of those things. I'm none of those things, okay? What I am is the embodiment of all of those. That's it. And that is from a standpoint where I believe that there can be no ego in medicine. You have to use not what is necessarily like your thing, your go-to, whether it's, again, muscle testing or acupuncture or herbs or essential oils or lab testing or whatever. You have to do what's best for the person in front of you. And some of those times you have to say, you know what, I can help you with this, but I'm also going to recommend that you go and do this with this practitioner as well. That's a beautiful thing when you can start to create a team for someone. Like if someone comes into my practice and they know clearly that there's some type of biomechanical issue, there's some type of postural-based issue, I'm going to have them meet with one of my personal trainers who specializes in that, or I'm going to have them meet with a chiropractor that does active release technique and will work on those specific things. And then if it's, you know, nervous system based, and I think that they would get great benefit from acupuncture, I might recommend that. So, you know, just keep in mind that you just have to do whatever is best for the patient and for yourself, obviously, if you're in that scenario. Okay, so let's get back to your question, Lois, since this is a great one, okay? Here's the deal. When you're on vacation, something's different, all right? So you have to look at that. Is it your diet that's better? Maybe, maybe not. A lot of times when people are on vacation, their diet's worse. Are you getting more sleep? Maybe, maybe not. Do I think that's the thing that changes the acne? No. What do I think it probably is? I think that you're in the sun, okay? The sun helps to kill the bacteria on your skin. A lot of people don't know this. In Ayurvedic medicine, they use sunbathing. They called it sunbathing, which means you would bathe in the sun. You would literally lie out in the sun, okay? Now, I know that we should not get burnt, and I agree with you. No sunburns, all right? We're not talking about that. But the sun kills bacteria in the skin, and it also helps to ramp up, believe it or not, the sulfur. I was going to say sulforaphane, but the sulfur-based detox processes in the body, all right? And that's one of the hardest things for the body to do on its own. Usually it needs to ramp up glutathione, and you can use nutritional supplements, or you can eat a lot of cruciferous vegetables. But here's the deal. I think it's a combination. You get sun, which dramatically boosts your vitamin D, but I also think that the bacteria is killed by the sun itself. I also believe that the vitamin D is boosting the immune system. And again, it's killing the bacteria. But I believe there's a bigger component. I believe that you probably have less stress. And I believe that stress for you could be contributing to your acne. So you want to look at that because, again, we already have the ingredients for what's getting you well. So how can we mimic vacation now when you're back home? That's what we have to ask ourselves. Well, we need to somehow deal with stress, and everybody has their own way of dealing with it. Going for a walk, that's a great one for me. For some, it's exercise daily. For others, it's a sauna. For others, it's quiet time. It's meditation. It's yoga. It's whatever it might be. Or reading. Reading's a big one for me too, okay? So we need to figure out that for you. But also, we need to be using things like the full spectrum magnesium for you, CBD oil, melatonin before bed, you know, liquid melatonin. Not forever. This might be for 3 or 4 weeks. Like, we need to get you into a rhythm where we can maximize the relaxation response. And the last thing I'll add is, again, the easy way to know if it's food or not is eat the same exact vacation-based foods for 2 weeks when you get back, okay? And if your acne comes back, but you ate the same foods, well, it's not the foods. So most likely it's the stress in the sun. All right. Hopefully that helps. Sharon's up next. Sharon's asking, I have started committing to the 12-hour overnight fast you have discussed in your podcast. Is there anything you could recommend to help the body with digestion and detoxing overnight? Sharon, great question. So check out this episode. It was episode 782, how to boost digestion, or actually how to increase digestion, I believe I called it, and decrease bloating. Okay, so that was episode 782. Check that out because that will tell you how to better break down the food. So basically any food you put in your stomach, how do you extract more nutrition from it? How do you get more nutrients out of that food? Because you can eat the best food in the world, but if your digestion is weak, we called it Acne on that show, right? Acne is the Ayurvedic term for strength of digestion, okay? You have to boost that. But the other thing is this, is that, yes, again, eat the good foods, break it down, but you're right. How do you boost it before bed? Because you want to go to bed with an empty stomach so that your body can then work on the immune system. It can work on decreasing inflammation. It can work on repairing the body, all of those things, okay? Regulating hormones such as thyroid and cortisol at night. Those are big ones that need to be regulated at night, as well as the sex hormones as well. DHEA, testosterone, as it starts to boost early in the morning. All of those things are very, very important. So how do we do that? Well, first thing is this. Stop eating 2 to 3 hours before bed. Game changer. Will it take a week or so to break that cycle? Absolutely. Will you crave something before bed? Absolutely. But we have to break that cycle. So how do we break it? Usually I have people, they're allowed to snack on veggies before bed. If you're really that hungry, then good. Have a purple carrot, like a real low glycemic carrot. Have some celery, totally fine. Have some other veggies right before bed, okay? That's it, just straight vegetables, okay? If you're really that hungry, then do that. Now, that's temporary, okay? Because what I want you to do is wean off of the chocolate, wean off of the couple scoops of ice cream, wean off of any of those things that you give yourself. It's just that little bit of a treat before bed, okay? Because we don't want that, all right? So now and again, listen to my show, Should You Eat Before Bed? I've done a podcast on this before because for people with low blood sugar, that's the only people that's like less than 1% of the population. Again, there's always a contraindication. So that would be the low blood sugar, the people who wake up in the middle of the night, not because of stress or anxiety or any of those things, but because of low glycemia. And that's, or low blood sugar, which is hypoglycemia. And that's mainly just in adrenal-based issues. Okay. So the other thing you can do too, and I gave you this, is again, check out 782 because I talked about all the different items that you could do to help with digestion before and after the meal. Meaning like you can use digestive enzymes any time of the day. Our daily digestive enzyme is super popular. People use that before the meal, and if they still feel really bloated after a meal, meaning like they just ate a huge meal or ate a poor food combination or foods that they shouldn't have, well, they'll take an extra 1 or 2 enzymes after the meal. And that will help break down the food faster. Okay, that's the whole point. Digestive enzymes are used to ease digestion. It puts enzymes right back in your stomach. The daily digestive enzyme, the reason why it's so great is that it also contains bromelain and papain. And bromelain and papain help to break down protein to a much greater degree. And it's protein that's the hardest to break down in the stomach. Okay, so hopefully that helps. Enzymes, like I said, super overlooked. Like it's almost every single person in our practice gets enzymes for the first 12 weeks of their program at least. And the reason is that if we take care of a lot of the energy, like meaning like if we give them the enzymes to break down their food, they automatically get more energy. And they get more energy because they have to use less energy for digestion. So hopefully that obviously just makes sense. So that's what I would do. And a ginger tea before bed, a bitters before bed. And again, if you don't know what bitters are, check out episode 782. Any of those can be consumed and they will help with better digestion. Okay. So Jen is up next. Jen's asking, I'm a 33-year-old female. I'm wondering how to lower high prolactin levels. My levels are elevated slightly. My levels have been elevated for a few years, but getting higher. I have hypothyroidism and I'm on medication, Synthroid. My menstrual cycles are very irregular and I have bouts of major hair loss 3 times over the past 3 years. My luteinizing hormone and FSH were tested in normal, both 4.5 and on day 2 of my cycle. I'm currently not trying to get pregnant, but I'm worried for my future. I really like to find a natural approach to lowering the prolactin level. Thank you. All right. So again, Jen, thank you. I mean, really great that you put this information in the question because the truth is you already answered your question, but I'm going to get to it. You'll see where it is. Okay. So for people who don't know what prolactin is, it's a pituitary hormone. Essentially, it's secreted and it helps with lactation mainly. We're talking about for women, but also in ovulation, meaning that it helps with the cycle. Now, it does affect men as well. So it's not like it doesn't affect men. It actually can. It can affect them in terms of hair loss, lower libido, erectile dysfunction, other items like that would affect men directly. And a high level for most people is over 1,000, but functionally we'll start to look at it over like 500. So on your blood test, you can check that out. Again, most people never check prolactin unless there's like ongoing based issues. And here's the thing. One of the things to know is I always look at, okay, what elevates prolactin? Someone has high prolactin. Is prolactin really the issue or is there something else? Okay, here's what elevates prolactin. Any type of stress, okay? Alcohol, dehydration, exercise, excessive sex, and then being in like the ovulation luteal base phase, okay? These are all somewhat stressful in the body. I would say not as much for the luteal phase. The luteal phase, prolactin just elevates anyways. But think of all other items that I've named, okay? They're a stressor on the body, all right? What's the one that I didn't name? Thyroid issues. So what we're talking about with you, thyroid, stress, any of these things can actually elevate prolactin. So it's really interesting. But I firmly believe that if you ran our thyroid adrenal hormone test, again, what I want to say just straight off the bat too is that we don't own any lab tests. Like we will never own a lab test, that's for sure, because I don't want to get in the lab testing business. That's a definite. But I don't own any of these labs. I choose the very best lab in its category, the simplest to use as well, that gives me straight up data that I need and that I can very clearly delineate from that the plan of action. So when I recommend a lab test to you, you can run it through us, you can run it through your doctor. I'm totally fine with that, meaning like either way is good for me. It doesn't, that honestly, my job is to get you the information so that you can take back control of your health. And I want to see a full panel, thyroid, and I want to see the cortisol times 4 times during the day. I want to see your progesterone and estrogen levels, but I want to see them for the last 5 to 7 days before your period. Okay. I also want to see your vitamin D, your insulin, and your hemoglobin A1C. I can see all of those things on the thyroid hormone adrenal panel. I'm going to link that up in the show notes today. Just go to stevencabral.com/785. That's where I'll put that. And that's what I recommend because I'm willing to bet that there's a cortisol or epinephrine-based issue, okay? I'm looking at some type of glucocorticoid issue with the cortisol. I'm looking at some type of a potentially like adrenaline or epinephrine or norepinephrine level. You can actually check that on an organic acids test, the waste markers of norepinephrine. So, that's what I would do. I would run the thyroid adrenal hormone first. If you can do a second, I would do the organic acids test. But really, it's that thyroid one that I'm talking about. Then I want to see what your TSH is, of course, and that your T4, your T3, your TPO, because your medication might be too strong or it might not be proper for you. So anyway, that's what I'm looking at. That's how you'll get your answer, I believe. And that gets you to that underlying root cause. All right, let's see. Christine's up next. Hi, I'm a non-standard PCOS woman, no polyps, but have insulin resistance. Currently, I take 1,500 milligrams of metformin, but I don't have diabetes. I take Cabral's activated daily multivitamin, as well as the Active B complex, zinc, vitamin D, vitamin C, and I take curcumin and extra folate. I eat fairly healthy diet, exercise. I'm lean, 18-19%. I'm an ectomesomorph. I'm 41 years old, trying to conceive my third child, but I have been experiencing multiple chemical pregnancies and miscarriages. I suspect I have high cortisol and some other hormone imbalances as I'm lean and toned everywhere but my belly and have steadily gained 7-8 pounds over a 3-month period. I have a pooch and slight love handles. What lab tests or other recommendations do you suggest that I do in order to lean out my midsection and see if any imbalances are contributing to my pregnancy troubles? Thank you. Okay, so great question. And I would always say, let's first look into why the insulin resistance, meaning that, you said that non-standard PCOS women. Okay, well, PCOS is, I'm looking at that as a symptom. Okay. So I'm saying why the blood sugar issues. And usually when there's insulin resistance, I'm looking at some type of cell membrane resistance. Okay. Some type of receptor issue. So your body's producing enough insulin, but it's not getting the sugar into the cells. Okay. That's, again, I don't have your blood work in front of me. On a house call, I can't go through all that anyways, but that's what I would look at. And so essentially, when someone has poor cell membrane dynamics, they're getting a lot of sterols in their diet. For some people, it might be too many saturated fats. Or for others, it just might not be enough omega-3s to balance the normal saturated fats they might have in their diet. So I would certainly run an omega-3 test to find out what your omega-3 saturation rate is. And if you don't want to run omega-3 tests, although I would use 3 to 5 capsules per day of the daily omega-3 support. Okay, the omega-3 support is by Equilibrium Nutrition, the brand I formulate for, but you're certainly welcome to use another higher EPA-based formula. That's obviously been third-party tested. Okay, another great product that I don't talk about almost ever is a product that you can look into by Orthomolecular Medicine, and it's called CM Core. And it uses berberine and some specific formulas that's actually been clinically tested. So this has been clinically tested that high-dose berberine versus metformin, this is a clinical study, was being equally as effective in reducing fasting glucose, hemoglobin, A1C, and triglycerides. So really amazing. Again, it just goes to show you that with functional medicine, with orthomolecular medicine, which is essentially using vitamins and minerals as medicine, that you can mimic a lot of these drugs and get better results, but naturally. Okay, what would I do for you though? Okay, so the omega-3 test, I told you about that, yes. But for you, I would run the thyroid adrenal hormone panel without a doubt. And I would run that 5 days before you get your period, anywhere between 5 and 7 days. Here's why. I do agree with you. I believe you probably have lower levels of progesterone. I really do believe that. I believe you have some level of estrogen dominance and higher cortisol. I just see that. I see it. I can just read it in the question that you're right. I mean, I can tell you're detail oriented. You're a perfectionist. You're definitely the Vata Pitta, at least mentally, for sure, just because I've done this a few times. And so I can tell that. And that's not a bad thing. That's a good thing. So I would run the omega-3 and I would run the thyroid adrenal hormone. All right. I think you'll get your answers that way. Let's do one more question today. I'm having fun here, enjoying being able to answer these questions. Craig's writing in, my 7-year-old daughter has had swollen joints for the past 2 years. Her doctor tested her for juvenile rheumatoid arthritis, JRA. And the blood test came back negative. The swelling is in her wrist and ankles, but usually one side at a time. It doesn't keep her from doing things like gymnastics, soccer, basketball, etc. But I also know that she has a very high pain tolerance. We are going to Children's Hospital in LA today for an appointment with a specialist. But I really want to pursue a more natural approach if possible. What test would you recommend running as a good starting point? Would one or some of the big 5 be a good place to start? Thank you for your help. I don't want my baby girl to be in any kind of pain. Craig, reading this question, I'm already choked up myself because I can only imagine, one of my daughters being in pain. I mean, that's the worst, because obviously no kid should have to go through that. They don't do anything wrong in terms of how they live their lifestyle. They don't know. They're just kids. So here's the thing. Let's make sure we take care of your daughter. For sure, rheumatoid arthritis does not show up on every single blood test. It doesn't. I mean, just for example, I've worked with multiple people. One person in particular that I'm thinking of right now, they are Skype concierge-based client. They're in Miami, Florida. They have swollen knuckles. They came to me with swollen knuckles, barely bend them. They're just all, wrist and knuckles, and then move to the elbows and a little bit, around the knees, but really mainly the hands, again, where rheumatoid usually starts. So here's the thing. They never tested positive, but they have all the symptoms of high RA or rheumatoid arthritis or RA factor. But it doesn't matter because we're not treating the blood work, right? We're treating the person, okay? When I say treating, I mean rebalancing, okay? We don't diagnose here. We don't treat disease. What we do is we work on the person. I did a podcast, okay? This was on 781. Should you be following a low lectin diet? Well, who did I say it's most important for? Typically the autoimmune, definitely the rheumatoid arthritis. We use a very special protocol in my practice with rheumatoid especially. It looks very much like the candida and bacterial overgrowth protocol because most people run the organic acids. Well, here's the thing. You're asking me which lab test, right? Your daughter seems like she has an autoimmune-based issue, okay? She has inflammation. For whatever reason, her ankles, her wrists, they're being attacked, okay? Here's what we want to do. Run the organic acids test. If we need to use the children's bacterial overgrowth protocol, we'll do that, okay? Just like we would do it for adults. And we'll help then to seal up the gut wall. I want your daughter, well, again, you can run an omega-3 test. We don't need to run the hormone test. No, I don't believe that we need to do that right now. I would run the food sensitivity test. I would run the organic acids test. I would run the stool test. Okay. I would do a full gut-based test. That's what I would do. And then if possible, I'd run the hair tissue mineral analysis just to look at copper toxicity or any of these metals, because it could be random, but your daughter may have been exposed to some of these metals, cadmium, arsenic, any one of those things. And as kids, they just can't eliminate it as easily. They can't. Their liver is not that strong. Now, Craig, I understand that financially, that might not be investment. That might be a big investment. I don't need you to do that if that's going to not be in your family's best financial interests. So let's run the organic acids test first. And then if you can do a second, I would probably run the stool test to look at parasites and to look at E. coli and to look at other things as well, like H. pylori. Then I would run the hair tissue mineral analysis. Then I would run the food test. Okay, they're in that order, all right? Because I want to make sure your daughter gets better. But here's the other thing. I will want to make sure, though, that she's getting some, after you run the test, not before, but after you run the test, we're getting some good omega-3s into her, okay? So usually for kids, we're using a liquid omega-3, higher in EPA than DHA because we want more of the anti-inflammatory. We can just use 1 to 2 grams for now. That's great. We can do that, no problem. And then I want to make sure we are putting her on what's called an autoimmune paleo or a low lectin diet, all right? Now, again, just go to stevencabral.com/781 and you're going to see all the low lectin foods. Make sure we get dairy out of her diet. Make sure we get all bread, all grains out of her diet for right now. Corn out of her diet, eggs out of her diet, soy out of her diet. I know that we're eliminating a lot, but remember, this is worth it. It's truly worth it. You only have to do this for 3 weeks. Make a deal with your daughter. We're going to do this for 3 weeks. If you start to feel better, well, then we're on the right track. Okay, we're going to eliminate the grains. We're going to eliminate the corns. We're going to eliminate the soy, the eggs, the dairy. We're going to do that, okay, because we want to make sure we get her better quick. We're going to do that for 3 weeks, okay? So what are we going to eat? Well, check out that show. You'll be able to see all that. And then again, you can do a health coaching call with my team right away if you want. You can run a lab. You'll get my personal recommendations, or I just gave you a bunch right there that I think will be helpful. Thanks, Craig. I want to hear that success story soon. So definitely get into cabralsupportgroup.com. Let us know how your daughter's doing. Thank you, everyone. Great show today. Great questions. Really enjoyed it. I'm going to be back tomorrow answering more of our community's questions. Take care. Have an amazing weekend. Before you go, I wanted to share a personal story with you. The real reason I began to get well finally is because I figured out what was wrong with me. And that might seem pretty obvious, but I went from doctor to doctor for over 2 years before discovering at-home functional medicine lab testing. These are the labs that enabled me to finally figure out what was wrong with my hormones, blood sugar, electrolytes, and gut health. And once I knew what was wrong, I could then follow a proven plan in order to rebalance my body from the inside out. This is why I believe so strongly in functional medicine lab testing and why I've made it my mission to share these labs with the world. Now at equa.life, you can order an at-home lab test or lab bundle for you and your family and be able to complete it within the week. Plus, the EquaLife difference is that you're not left to try to read and figure out these labs on your own. We explain what your lab numbers mean, what they mean in the much bigger picture, and then how to go about rebalancing your body in order to heal. To see our full selection of lab tests or to set up a free lab selection call to find out what labs may be best for you, simply head on over to equa.life/labs. And do remember, we ship these all over the world. To find out more and to set up your free lab selection call, simply head on over to equa.life/labs. That's EQUI.LIFE/labs.